great and sunny day to hear from Mata and some of her team about our school nursing update, including our school-based health center and data collection and student advisory committee. So thanks, and take it away.
Thank you. I'm Marano-Bianco. I'm the Director of Student Health Services here at Edmonds School District. I have brought with me some wonderful individuals, which I will have them introduce themselves as well, and their role associated with the school-based health center.
I'm Jen. I am a nurse in the district, and I help support the school-based health center at both Mount Lake Terrace and at Meadowdale, and I run the advisory committees at both school for the students.
Hi, I'm Aisha. I'm a student at Meadowdale.
I'm Celia. I'm a student at Mount Lake Terrace High School.
Excellent.
And we should probably introduce ourselves. So I'm Nancy Katims, I'm president of the school board.
I'm Deborah Kilgore, and I'm vice president of the school board.
Smith and I am one of the board members.
I'm Rebecca Minor, superintendent.
Okay, ready to go?
Yeah.
Okay. So we wanted to get in front of you a little bit just to talk about where we have come from in regards to the beginning of the school-based health center journey and where we are today. And so we wanted to give you a bit of an update on all of that. So how far have we come with them? Gain an understanding of the indicators that we're using to measure our progress of our school-based health centers. Keep in mind our school-based health centers aren't run by us, we're partners in this endeavor. They're actually run by Community Health Centers of Snohomish County, which is a federally qualified health center within Snohomish. So, and then learn some of the challenges of our data collection and how we work with school-based health centers on built processes and
I'm sorry, I'm
systems.
just going to step out because it looks like our door is locked, so I'm going to go use the unlocker and unlock the door.
And how figure out how to measure the successes and improve our quality over time. So way back when, we talked about what our goal was, and our ultimate goal was to improve both the educational and health outcomes of our students and school community, where everyone has a fair and just opportunity to obtain their optimal education and health regardless of race, ethnicity, disability, sexual orientation, gender identity, socioeconomic status, geography, preferred language, or other factors. Really looking deep at those social determinants of health and making sure that health equity was in place for our students. Our outcome was really to look at how do we change the lives of our students, our families, and the school community as a result of our school-based health center. And the indicators are looking at specific measurable information collected to track whether an outcome has actually occurred. So what have we done in regards to our inputs? What have we invested? So we have funding partners and funding sources. So we have funding partners such as Verdant, Foundry 10 has supported us, and Edmonds Foundation has supported us. And that's where our sources come from. In regards to in-kind partners, we have the CHC, we have Therapeutic Health Services that provide co-conditions, training, counseling for those who are drug affected and have mental health issues, and then Community Center for Human Services as well, where they provide our mental health counseling within our schools. So they partner with CHC, our community health centers, to do that. We also partner with our school staff, and we also partner with our health services staff, as well as our medical dental providers in our local area and our behavioral health specialists in our local area. And then we have direct support from our school district through in-kind, such as myself, building, maintenance, custodial, things of that nature. So that has been our inputs. To date, our outputs is we have 2 school-based health centers, one at Meadowdale High School and one at Mount Lake Terrace High School, which service all the feeder schools as well that feed into both of those high schools. So we do service students from K to 12. They cannot do preschool because they don't have the ability to do children under the age of 4 at a school-based capacity. Okay. So our activities, we're doing regular outreach and education to students in regards to health issues and concerns. School staff are our partners, so teachers will support students coming down typically for an appointment. They things of that nature. We are finding that the time that students are out of school has shortened due to health appointments. Our nurses, that's okay. Our nurses are the primary source of referrals as well as other staff members. Sometimes parents will come and request appointments and our nurses help navigate that for them. The school-based clinic is currently doing assessments of physical and mental health strengths and risks. They are offering medical diagnosis and treatment options. They are also doing very brief behavioral health interventions. Anything that's more intensive is referred out. They're helping us with immunization compliance. I can honestly say we had several middle schools this year for the first time that were in 100% compliance. We've never had that before, and that was Meadowdale Middle. We had never had that before because that TDAP is so hard to get. And then support in school crisis response. If, for example, there is a crisis at the high schools, the CHC team does support us with those. So it's been really a wonderful partnership so far.
Could you give me a little bit more detail around where we end and referrals begin? Like, what is the sort of line?
Data's coming.
Oh, okay.
Yeah, I'll touch on that.
Okay.
And so in regards to outcomes and impact, short term, what we're already seeing is a school connectedness with that school-based health center. We're seeing an increase in health knowledge, positive practices regarding health behaviors of our students. They're learning some self-care techniques and coping skills, disease management. So some of our students that have asthma or type 1 diabetes or even type 2 diabetes are able to make an appointment right there and then, and they're able to manage their disease. They're not having to wait 3 to 4 weeks to get an appointment with their primary provider. They're learning a little bit more about symptom awareness, their ability to make a health decision, and this is the prime reason behind the school-based health center. It's that bridge that from, being with your parents at an appointment to having that bridge and learning to become an independent health consumer. And so that when they're 18, they have the ability to know the system and how to navigate that. Communication skills, learning how to talk about what they're feeling, what they're seeing that's going on with their body, and really being able to do that with a trusted medical provider. Pro-social behavior and engagement with that provider, and academic engagement. So they're not losing as much class time because they've got a 20-minute appointment and then going right back to class. They're not having to take hours to go to a medical or dental appointment. Immediate, appropriate care-seeking behaviors. We do have students now seeking appointments. Sometimes they will go to the school nurses to do so because they're starting to learn how to navigate that school-based health center experience. Increase in that instructional time because they're not having to leave school for those appointments. Improved access to health care. Improved health equity because it's open to everyone and it's at no cost to the consumer, okay? If they do have insurance, they will bill insurance, but if a family doesn't have insurance or can't cover the co-pays, it's at no cost to the family. And student involvement, and we have some students here today who can talk to us a little bit about their involvement. Long term, we're hoping to see some improvement on mental health and physical health. They say it could take up to 5 years to really see that needle move, but we're anticipating that coming. Improved attendance at school, improved grades, because this is evidence-based, and every high school that does have a school-based health center does see an increase in attendance and an improvement in grades. Reduced disciplinary is also evidence-based for school-based health centers, and a reduction in risk behaviors is also evidence-based. Okay. I will now pass it on to Jen, who's going to talk a little bit about the data that we're seeing and hopefully answer some of your questions.
I'm gonna stand up. I have a hard time catching my breath. I'm sitting down. A lot of pressure on my diaphragm. So, like I said earlier, my name's Jen. I help support the schools in the school-based health centers. The first area of data collection is the school nurse referrals. So starting in January 2024, I started in December. So with winter break and everything, really we kind of got the data collection rolling in January. I created a log for both the high school and the feeder school nurses to track those referrals that they were making. Some of these examples are immunizations, dental exams, sports physicals, general medical, mental health, and reproductive health. Some examples of general medical would be injuries, whether at school or not at school, illnesses, ongoing issues, and wellness checks. So on average for the high schools, we're seeing right now about 7 to 10 referrals per week made by the nurse. For the feeder schools at Terrace, we just opened the feeder program because that is a newer health center that's been opened. So we haven't seen any data from that yet, but for Meadowdale High School, they're doing about 10 a month. I will say one of the barriers to collecting this data has been it's a new process for the nurses, and in their busy schedule, a lot of times they're seeing kids on the fly in the health room, and so they make a lot of referrals that they're not necessarily tracking down, and I see that myself, a lot of referrals being made that aren't being documented, and so I think over time this process is going to get a lot more streamlined, and we're going to capture this data a lot more cleanly, but this is what we have for right now, and we anticipate this going up.
Can I ask a question? Are we still gathering permission forms?
Absolutely.
So parents are on, or guardians are on?
Yes.
Correct.
Yes, and so when, for instance, I refer a student, if they haven't been in the school-based health center clinic yet in the system, I usually, or even if they have, because I don't necessarily know because that's a HIPAA confidentiality, so I usually call the parents and just say, hey, I just saw your student and they're having such and such issue. We have this clinic on campus, would you like them to be seen? And then if they say yes, I say, okay, great, I'm gonna have the student go to the clinic and then the clinic coordinator is gonna call you. And so then I take the student over there, they call and organize getting the registration and the consent forms. Now, those registration and consent forms are good for their stay at that school, but they still call the parents every time a student needs an appointment when they're under the age of 18.
I think I might have misunderstood this, so I just want to clarify this. This is, student goes into the office, speak to a nurse, and the referrals here are to the community-based health center, which is on campus.
Correct.
Okay.
Correct.
Okay.
Now, this is not including the kids that are going themselves to the clinic.
Okay.
And that does happen as well, especially more so at Meadowdale because the community and the culture around the school-based health center is more known. So the students know where the office is, they know the coordinators and the providers, and so they feel really comfortable going and making that themselves, but sometimes they don't, or we still find that there are students that don't know the resources available to them, which is why we have developed this role.
And the other thing, the outcome data as to how many appointments and things of that nature doesn't necessarily belong to us. It's that HIPAA, FERPA, we have to be very careful of. And so they will eventually give us de-identified data of how many appointments they have had, but we have to be very careful in making sure it's de-identified. So we don't.
So when you say eventually, do you mean on some regular basis or?
We ask every 6 months roughly what the data is looking like, so we have some idea of what they're seeing, and we have some of that to share.
Yeah.
with you.
And I'll touch on that more. And I've been working, again, I'll talk about it in a moment, but I've been working with the clinics about looking at our monthly trends. So to just capture it, and that way we can see, are there months where we have really high rates where people are making appointments maybe in the fall, flu season, things like that, or are there lull months?
So we wanted to capture our referrals and basically where we're seeing our referrals, so we know what we are sending to the school-based health center as well.
So I'm curious, I understand de-identifying, and I assume that's names, but are you able to get data on the student's grade level and, if it, again, other demographics, are they special ed, are they, multilingual, and things like that?
Yeah, so if we have an ROI, a release of information, we can collect that data specifically. So this is why it's been a difficult process to build that system, because of that HIPAA FERPA law. We can't share our information with them and they can't share their information with us. So we're trying to navigate. We can share each other's information as long as it's de-identified, which, we can't get birthdays, names, things of that nature. But we can get general, 9th graders, 10th graders, that kind of thing. So.
Yeah, and again, I have more of that data, and I'll touch on that in a few slides. So So, at Terrace, since opening the clinic in January, you can see for the nurse referrals, the majority of the referrals are going to general medical, sports physicals, and immunizations. That this is a newer clinic, and so, well, yeah, we'll touch on that in a moment, sorry. Okay, so and at Meadowdale, these numbers look a little bit differently. Somewhat similarly, we're doing a lot of referrals for general medical, less for immunizations, but more for mental health and reproductive health. Immunizations, I believe, is less here because Meadowdale's been open longer. So there hasn't been as big of a push and a need for those kids that didn't have that access. So at Terrace, especially when it first opened, so many families and students wanted to utilize that resource once we got the the vaccines. And so we had a huge push of kids coming, or we reached out to the students that weren't compliant, and that we maybe weren't excluding because of COVID and other reasons that were barriers for them to get this care. And we were able to get them in. And so some weeks I think we got over 20 kids vaccinated, their updated vaccines, which was really great. Another reason why I think here we're seeing more mental health and reproductive health referrals is because these students are more comfortable at the school with the clinic. Yeah, and so they understand the clinic a little bit more now, and they feel more comfortable coming to the nurse and saying, hey, I've got this and such going on. Can you help me make an appointment? And then we navigate it from there.
So what's the total number of people, of referrals from January to March 24th? The percentages?
From January to March,
Yeah.
I have that on another slide, and again, I will talk a little bit more about this. It's actually in my...
It's in the next couple slides, man.
Okay.
I can look at that.
I was actually...
I just wanted to comment on immunizations. We had a hard push last year for immunizations at Meadowdale. So our compliance rate there is a lot higher because of that school-based health center. So this year, the compliance rate was a lot lower in regards to having to catch people up with vaccines because they were ready for school entry. So.
Yeah. And again, on the last slide, I talked a little bit about the numbers of the referrals. And again, we aren't capturing, that data is not being captured as accurately as we would like it to be right now because it's a new process. So we hope to soon have a better understanding of that. And actually, we go back one more. And then you may recall at Terrace and at Meadowdale, the dental referral rate is really low. But I just wanted to point that out, but I will touch on that in a later slide as well. Okay, go ahead. Okay, so for the feeder schools from Meadowdale, from January to March, here are the numbers. The most are immunizations and dental, which isn't surprising. A lot of young kids need more vaccine updates, and a lot of children are establishing dental care at the schools, which is really great. And so a lot of our dental appointments are being utilized by the feeder schools, more so than the high schools. And then you have a little bit scattered in the other areas.
And we are seeing a larger number of newcomers utilizing the school-based health clinic, only because it's no cost to families, number one, and number two, they are having difficulty finding providers and establishing care. So this is one of the reasons why school-based health centers are very open.
With dental, can they get anything, just to check, can they get a filling?
Yeah.
Yes,
Yeah.
So this is a kind of a.
they can do x-rays.
Yeah. Yeah. There's a lot they can do, and then anything that's more specialized, wisdom teeth impaction that need to come out or root canals, they can then go see the CHC clinic in Lynnwood and they get them set up with that.
And I think that's the bonus of having this partnership with CHC and within our schools. Typically, it takes anywhere between 3 to 4 months, 4 weeks to get a regular primary care provider appointment. They can do it within, either same day or within 24 hours. They can get an appointment at the CHC location.
Yeah.
So
And as a
our kids
person,
are kind of fast tracked.
as a person who's trying to establish care here, because I maintain my care where I have been, I haven't been able to find anywhere where you can establish care in 3 to 4 It's
5
more
months
like,
out.
it's more like months.
I
Yeah.
still have my providers all in Seattle because no one's taking new patients
Right,
here.
I mean, you can put in some of the big systems, you can put in, I'll go anywhere, and they are still 5 months
I
out.
know, Snohomish still says it's 31 days, the average wait time, but.
Well, that's,
Sign me up.
Exactly.
So I had a question
And that's also access to getting appointments with specialists, so, yeah.
that piggybacks on Deborah's here. So, I understand, so once we send them out there, that is the community health center stuff, so we maybe don't have as much information there, but is that being staffed by like doctors, nurse practitioners, like kind of what is the level of care that they're providing for
It's
that?
physician assistants and nurse practitioners.
Okay.
Yeah, as well as dental, actual dental staff.
Oh, okay.
Yeah, dentists and dental assistants.
Nice. Okay, cool.
So I'd like to ask a question.
Mhm.
There's been a lot of misinformation out in social media and whatever about what we provide and don't. So under reproductive health that you mentioned, could you be really specific about the kinds of things that are done and are not done?
So, from the school standpoint, or like where at the school-based health center, a lot of it is preventative care. A lot of it is women's health. A lot of these kids don't have access to these things otherwise. And, you know, especially for health equity in our area, equity is so important for our students. We were able to provide this. Now, if it was anything specialized, procedures, things like that, that would be referred out. That is not done in the schools.
Thank you.
Yeah, so things, so things like abortions and things like that are not done at a federally qualified health center to begin with, and nor would they be done at the school-based health center.
Thank you.
And a lot of the students that I see are really looking for education
Correct.
and maybe have like, I mean, it's really hard because women, or just reproductive health in general is very personal. But, you know, just routine things that come up, you know, when you're a young adolescent that you want to see a doctor, but you're kind of embarrassed about, or, you know, and so this is something that they can access and not feel ashamed of and get that culture at a younger age of like acceptance, things like that.
But just to be, I mean, they could get that birth control, right?
Yes.
Absolutely.
They can get birth control.
Under the state law, at the age of 14, they can already get that regardless.
Right. And just
Anyway.
once again, to be clear, the health center is really a separate party. That's-
Correct.
The
It is.
school is not giving out
Correct.
birth control.
Yeah, we're
Okay.
partners, but they are a separate entity.
And I will say, speaking from the provider's perspective that we work with, who has said this many, many times for both reproductive and for mental health, although these are protected confidential services for the students, she really tries to help understand why these students want to keep these issues confidential, and she helps them navigate that conversation with their parents because she's not trying to keep anything from the families. She's like, the whole point of this, like, you're gonna receive your best care if your support system is involved. And so a lot of times, she said more often than not, they just don't know how to navigate that conversation.
And
So
how to
she
start that
helps them.
conversation with their parents.
Yeah, and so
regarding.
she sits and helps them in what way they feel the most comfortable with starting this conversation.
And a lot of the reproductive health stuff is really learning as adolescents move through that stage of growth and development, what's happening to their bodies, right? And then they have someone that they can, who's not gonna judge them, who's gonna listen and, you know, help them navigate that experience. It may be embarrassing to talk to your mom or dad about what's happening to your body, right? So this is a healthy way to do that.
Yeah. And we'll touch more on some student stories from the students here, but what's really awesome about this is that, especially for sports physicals, immunizations, like we kind of touched on before, it's really hard to get your provider, and students are finding that for their sports physicals, and there's a deadline to get these in.
Yeah.
And so it's good for 2 years, but say it's up, and a lot of students aren't keeping track of that. So we, as nurses, we're like, hey, you need your sports physical, and then they're like, oh shoot, and then they have a week before season starts. And so many students are not able to get appointments in that time. And so now they're able to get them and be on the field or gym or
And they
the
try
next
and
week.
block appointments purposely for the sports physicals to make sure that
During that
kids
time.
know. Yeah.
Yeah. And our providers have been really wonderful, especially our dental team, in finding ways for double booking appointments. So if they know that this appointment's not gonna take very long, they'll, like if there's a dental emergency or something, they'll stack and then fit them in and, you know, fit them in during their lunch and things like that. And they know how important it is for the students, especially sports and activities, to get to. So they really work hard at getting that. So this is the utilization for March. I first want to say, one of the challenges that we had collecting this data, I worked really closely with CHC employees, and their data was being captured as not school-based health center on its own, but with Lynnwood Clinic. And so all of our appointments were together. And so we really couldn't see what appointments were happening at the school-based health center versus at the clinic. So moving on, like from April on, they found a way to clean that up and were a separate data collection. Now, the clinic care coordinator was able to separate just for March. However, March was not the best month because our provider has been sick, and we only have one provider being shared between the two schools and one clinic care coordinator being shared between the two schools currently because the other's on maternity leave. So these numbers, I anticipate getting much better, and I'll talk about that in a moment. But those barriers to staffing have been huge for our clinic last month and this month. And they've had to cancel some clinic days, reschedule, things like that. But they have hired 2 new providers to cover one for each school, and then our provider now will oversee them and then cover when they're out, and another clinic care coordinator, and they all start this week. So in May, our numbers should look much better.
And they're also anticipating having now 2 new providers on board for the school-based health center, possibly adding an extra day for medical, because right now it's only 2 days medical a week and 1 day dental, and they're realizing they need another day for medical.
Yeah, and I think they might even open it up, so 5 days a week for medical, 1 dental. And especially at Meadowdale, we can see that will be really beneficial. I know that these numbers are kind of wonky because of cancellation days, but speaking from being at Meadowdale on their clinic days, there's usually never room for walk-ins. It's really hard if we have a student that comes in injured or sick or something. And a lot of times I'm like, man, I really want to send you to the school-based health center, but I don't think we can wait till the next clinic day. I think we need to go to urgent care. And so I think that will really bump up our referral numbers too, because sometimes we can't accommodate them. And for dental, they're booked out weeks in advance typically.
Do you want to talk a little bit about the barriers
Yes.
to the no-show rate?
Yes. So our no-show rate, currently our barriers for that are the staff and teachers. Our current process is handing out the passes at the beginning of the day, and they have the students that are in their classes and what time their appointments are, but the students aren't getting those slips. I've had many students very frustrated because they either receive them after their appointment time or never receive them at all. This is something that we've addressed with administration, and we've done a lot of education for staff in the meetings and emails and all sorts of different education around the importance of this. And really, these kids would be normally missing a lot more school versus 30 to 45 minutes of their class. So that has been a huge barrier and a huge reason for our no-show rates.
Who's supposed to be giving them the passes?
So we have this right now. The clinic sends the passes to the attendance office TAs, and they send them out to the teachers, and the teachers give them to them. So the problem with the process of changing the process is HIPAA. So we don't want these students to be identified as, oh, they're using the clinic, like what are you using the clinic for? And so the best method that we had figured out was to give them, and the teacher would give it to them at the beginning of their period. Like not disrupt, we're not coming and disrupting the middle of class and pulling them at the time of their appointment. But obviously this isn't always working. So CHC is looking at a solution to this, but also we're really working with administration, the building administration, who has been really supportive, but on getting the why across of why this is so important, and you really need to be giving these students. It's not, you know, at your convenience, or this is a healthcare resource, and really it's their right to be able to go to these appointments.
Would the kids be able to just pick the passes up at the attendance office themselves?
Yeah.
So
It's how do they get out of class? The teachers want.
No, but I mean like at the beginning
at
of
the beginning of
school.
the day,
Yeah, that
Yes,
could
they
be.
come from school, go
Yeah.
by the attendance office, pick up the pass.
yeah,
And then when it's their time, show it to their teacher and go do it.
yeah,
Yeah, take the teacher out of it.
yeah, yeah. So that's a good idea. I'll bring that back to CHC and see what they think.
Or can I have it digitally?
A digital.
Oh, yes,
Yeah.
digitally.
And they're working on that. CHC is already working on a lot of digital processes to work with the students, so that could be a suggestion.
Yeah, they're also
Show the
working on,
teacher.
yeah, they're working on text reminders too and things
Yeah.
like that, so.
I think that, I mean, just my personal opinion on this is that that's like a double tragedy there, because not only is it that student that's getting their appointment, but another student who's already waiting to get an appointment isn't taking the open appointment, so,
Right.
so it's definitely something we wanna,
Right.
Look at
And
fixing.
I know CHE has taken it very seriously, and we had a student that had been waiting weeks for a dental appointment and then didn't get his pass. And we made sure that the next week he got in that week, and we're very adamant that and the providers agreed, they're like, yes, we'll get it in.
It just seems if you can take the teacher out of it, who's busy and has a lot of other
Yeah.
things they
Right,
have to do.
that's the thing, there's a lot.
That's one thing, but secondly, that removes one person in terms of they have a FERPA problem as well.
Correct.
There's one less person seeing any of that information.
Correct. Yeah. Okay, so the last category of data collection has been attendance rates. I pulled attendance from the last 2 years. This is something that we're not gonna see changes for, we anticipate for 5 years down the road. But we wanna start looking at it now and doing the work now. Like Mata said, schools that have school-based health centers typically or do have better attendance rates and better grades. We anticipate these numbers, which are pretty similar between the two schools, to go up when they're not having to leave school for half day, full day, few classes, when they're really just having to go for 30 to 45 minutes for their class. Right now, the culture is that they go, they check into class, they get there, and the appointments are during class, so they'll always go to class first, check in, say I'm here, and then go.
But they do offer appointments after school as
They
well.
do.
So have that in mind.
And usually those appointments are used by feeder schools, but there are options for the high schoolers as well.
And part of that was safety. We didn't want a whole bunch of littles in a high school necessarily, so we wanted them, and they're coming with their parents, so.
Okay, so the other area that is a lot more exciting than data, well, for me, I guess, is the Student Advisory Committee. So this has been something that I've had a lot of fun developing with the help of the nurses at both Meadowdale and Mount Lake Terrace, Cass and Sherman, and then collaborating with the students and the staff on the committee. So our mission statement that we got together and made, empowering students to advocate for and promote the health and well-being of all our peers. And then we envision a school where a student-driven advisory committee works with the school-based health center to foster a culture where all students feel empowered to take charge of their health and access the resources they need to thrive.
Be done, guys.
So the advisory committee is a student and staff-driven committee that represents diverse members of our school community. Members share ideas and recommendations regarding challenges and barriers to using the school-based health center, as well as solutions to support the students. We represent the student body and the community and bring back concerns that we hear from them. So we meet every month for 1 hour, sometimes more frequently if we have events coming up. We share thoughts and discuss current health topics and what's important to students. Create and give feedback on health materials and advertising, as well as be a resource for their peers. So expectations of the Student Advisory Committee, to act as ambassadors for the school-based health center, to help the school-based health center staff create a safe activities, to engage in collaborative discussions, to provide feedback on how we can enhance the school-based health center and evaluate the existing services, to provide input regarding the school-based health center, promotional and marketing materials, such as we created Instagram pages. They helped do that, and they know the students have given us feedback. You know, this is the best way to reach out to the other students is through Instagram or through this, and so then CHC and the advisory committee work together to create these marketing materials, and then have an interest in the healthcare field as a possible career option.
And just on a side note of that, we're working with Mark Madison right now and the STEM programs, and we're creating a pathway where students who are interested in health fields such as dental assistants or medical assistants can actually, through the Edmonds Community College, as they graduate, either graduate also with an MA or a DA or close to it, so that they can get into the work field right away. So we're working with CHC in that, so that CHC does the internships for these students.
And we do already have a student from Meadowdale that's been set up with an internship at the Lynnwood location, which is really awesome. So our goals for the Student Advisory Committee, our first goal is to help peers distinguish between the school nursing office and the school-based health center clinic. Many students identified that this is confusing for them. So we've tried to help navigate the key differences between the two. Our second goal is to educate peers and community on the services and resources provided by the school-based health center, as well as how to utilize them. Our third goal is to promote health equity. We hope to bridge the gap in access to healthcare for many students, and the advisory committee can help identify barriers and have a direct insight through various types of community and that's my next one, sorry. But they have a direct insight. That was my pregnancy brain, sorry. Okay, but then also integration into the school and community, and we hope to do that through various types of community and school events. We've really learned over the last few months that there's so many different avenues that we can go down and still not get the message out to everybody, and so we're really trying to explore different ways to reach our students and our community.
So before we go to the students, I just want you to have an awareness that Jen's position is funded through Verdant. So without her, we couldn't really help build the culture and build the systems that we need. So thank you, Jen.
I really appreciate that. Can I, before we go on, does the school-based health center give prescriptions?
Yes, so limited, but there is a student story that we'll talk about that touches on this, but there are some instances where they carry the first dose of antibiotics, the Tylenol, ibuprofen. I know those aren't necessarily prescriptions, but we can't give those as nurses, and sometimes the kid has a really bad migraine at school and they don't really want to go home, and we'll just call the parents, have them go in there, they'll give them ibuprofen, get back to class. But they do have some prescriptions at a limited quantity to help with these kids, and then anything else, they send them to a nearby pharmacy and try to help get that covered cost-wise.
And just to be clear, we don't do gender affirming care, is that true?
That is correct.
And we do not give puberty blockers.
Correct.
Thank you for just
And then,
making that clear.
yeah, and the other thing is, a lot of times they'll also send it directly to the CHC pharmacy, because that pharmacy can do things at a sliding scale that other regular pharmacies cannot do. So that's the advantage of being with a federally qualified health center as well.
Okay, I am going to introduce Aisha. She's from Meadowdale High School. She's one of our students on our advisory committee. She's going to talk a little bit about what we do, what we've accomplished so far at Meadowdale High School.
So Meadowdale High School's school-based health clinic first opened in September 2053. So we so we've not a lot of students knew that we had a clinic. Like the hallways are super lonely. Like a lot of people have described that's kind of scary. But so like I don't know.
Do you want to look at my? You want to look at the slides in front of you?
Yeah. So there's a lot of confusion surrounding these differences. A major barrier to understanding that we identified that now the clinic coordinator's office location used to be a health room, so many students did not realize that the location has changed. In order to help this message to our peers, we worked with ASB, and ASB is like, it's like a morning video, it's really fun, and we worked with them and we created a video so people knew more of what we, like, knew more of the clinic and just like to help students understand that it's like okay to come visit. So,
Yeah, and also just to know, like she said, where the clinic coordinator's office is used to be where the nurse's health room was. And so it's really confusing. So a lot of times we were hearing from kids, they were going, and they were saying they were going to see the nurse. But then we were like, well, I haven't seen you. And we were realizing they were going to the clinic. And so we, with the advisory committee, created this video so that way students understood, actually the nurse's office is in the main office. And if you ever have an issue during school, you need to come to the school nurse. Injury, illness, anything like that, and then we can refer you. But if there's something that ongoing issue, confidential stuff, they can go directly to the school-based health center. But that needs to be also done outside of class. So after school, between periods, during lunch, things like that. But if you have an actual issue at school that's causing you to miss class, then you need to see the nurse, and then we know where you are, and we can help you navigate that.
another event we've done as an advisory committee to begin engaging with the community was we had a booth at the Health and Wellness Fair put on by the district's nurses at Meldale High School. Here we helped explain the work we were doing at Meldale to the members of the community and as well as reiterate the resources available to them. We got a lot of parent feedback regarding barriers to their understanding of how the clinic functions and who it serves, which has inspired us to create future events and look into other ways to reach out to others.
Yeah, one of those big barriers where a lot of parents didn't know that this was for people that also have insurance. They thought it was only for students that were uninsured. And so getting that message out and then asking them, how do you receive your information best? Because we've tried to promote this and explain this to parents. And a lot of times we send messages through Parent Square, but a lot of these parents say, I stopped reading Parent Square a long time ago because I get too many of them. And so we get like overwhelmed, and so we just don't read them. And so some said to send things home with students, but then when I talked to the students in the advisory committee, they said, I would never give that to my parents.
This is why they're so important.
Right, and so that's where their feedback comes back, and how do we reach across to you guys the best? And again, they talked about Instagram and social media and how even like a lot of their families follow the account. But also, you know, we kind of, and I'll speak about this again more, but we kind of figured out some other ways that we can reach the families more effectively.
We've also created up sign-up sheets to give to teachers to bring to their classes to teach just like others how to like learn the process of making an appointment, as well as where to go, because again, not a lot of people knew where the clinic was, nor like what's the difference between like going to the nurse's office and then going to the clinic, like getting an ice pack or something. But yeah.
Yeah, and we set up some tours for those classes. So quite a few classes signed up, and we really targeted at the classes that have like PE, that have all the grades, not just, you know, specific grades, and then the health classes, so that they could come. And then I brought them to the clinic. I showed them, you know, they met the provider, they met the clinic care coordinator, they got to see all of how that works, the process, and then brought them to the nurse's office and just reiterated, here's where you come for the nurse. But yeah.
We at first lunch we had a question and answers booth on March 18th for students to visit during lunch break. We had information about the advisory committee, answered student questions regarding the clinic, as well as we had registration and consent forms for students to take if they would like. After our first booth, we learned
I'm going to introduce Cecilia. She's from Mount Lake Terrace High School, also part of the advisory committee, and she's going to talk a little bit about what we've been working on there. It's a little bit different because Mount Lake Terrace is so new, and we got to develop the advisory committee as the clinic opened, whereas at Marano-Bianco we kind of backtracked and the clinic had been open for a while, and then we were able to know what the barriers were a little bit more and address those. So go ahead, Cecilia.
At Mount Lake Terrace High School, we focused our attention primarily on promoting our new clinic as well as representing our peers at a ribbon cutting ceremony for the SBHC. Like at Meadowdale, we also had classroom tours set up for the grand opening of our clinic. Since the SBHC was new this year, we mainly prioritized spreading the word, like I mentioned, as well as showing them the appointment-making process and detailing the multiple resources available. We also assisted in the creation of a social media post with information about the SBHC and how to make an appointment that went up on our Instagram page for ASB. This was part of the promotion we did. We also set up a monthly lunch table Q&A. This month we collaborated with our school nurse in getting vision screenings for students who didn't have them due to COVID or they didn't have any access to vision care. At the same time, we also used the booth to promote the SBHC since we found that a lot of students still don't know the SBHC exists or they don't know how to use it. That's a problem because it has so many useful resources, especially for our school's demographic and where we're located. This reminded us that we have to try to reach our peers through multiple different avenues of information and education. One way we want to do this is by collaborating with ASB again to make an educational video to be shown during past period. So we have some student stories regarding our campus clinic too. Upon opening, we were ending our winter sports season and about to enter spring sports. We had a lot of students who weren't able to get in with their healthcare providers because some were booked months beyond our deadline. After the opening of the clinic, these students were able to get in right away and receive their sports physicals well in time and also minimize missing classes to do so. Multiple students have also been needing to get required immunizations, but stated they couldn't get the transportation during the weekdays or they're unable to get in with a provider despite advocating for getting in. After hearing that we had our vaccines available at school, one of our students was super excited that he could finally get updated and not have to worry about exclusion. This social media post by Mount Lake Terrace High School parent regarding their students' immediate care is an attestation to the awesome collaboration between our school nurse and the clinic, and the resources that are available to the students and families of our Mount Lake Terrace High School community. A student presented to the nurse's office with a severe headache, or earache, sorry. Nurse Jen suspected an ear infection and referred him to the SBHC, who was able to have the student seen right away without the parents having to take off the day or leave work and try to get into primary care or urgent care.
Yeah, so the student was able to be seen by them. They gave him some pain medications, Advil, Tylenol, and sent a prescription off that his mom was able to pick up on her way to pick him up. He felt okay to go back to class, but did have a really bad ear infection. And so we were really excited to see this on Edmonds Moms because that's another way that we can get the word out, is by the community promotion. And this mom was just so thankful that she didn't have to take off work. And she had said that she, like you can see here, she never thought that she would need the school-based health center and that, you know, this is a great resource, but you won't need it. But you never know when your kid's gonna get sick or have something come up. And so, you know, we've seen kids that cut their hand in auto shopping and need stitches and things like that. Like it's just,
Inhaled chemicals in chemistry class.
Yeah.
So they're just seen by the nurse, right?
yeah, and so these things usually we as nurses say you need for don't have to receive double vaccines, and they can get those results back same day, get them the vaccines they need, and a lot of students are starting the next week. And so that has been a huge turnaround that we haven't had in the past for these students, which is really great.
So that's an interesting piece, because that actually wouldn't show up in the attendance data.
Correct.
Right. Because they wouldn't be, so actually getting kids into school faster is going to be reflected, because we're not marking them absent until they get to school.
Yeah.
Right.
So that's a cool way to think about that too.
And they really worked with us at the beginning. I know Meadowdale did this year, making sure that they had a number of days open specifically for immunizations before school even started. Because the nurses already identified which students are out of compliance, and they just dedicated those days specifically to immunization. So maybe it's a reflection of ongoing 4-day count. I'm not sure, but that fluctuates so much for many different variables. But I know this year we had the lowest non-compliant rate that we've seen since I've been here. So.
And from the referral data, that's really capturing what the nurses are doing, but it's not capturing our registrar, our counseling center, who are also referring a lot of students to these services. I know that counseling has other services that they can utilize, but they're not always available. And our provider is comfortable seeing children for mental health. So it's a really great resource for them.
Aisha, did you want to say anything else before we moved on?
I mean, there were a couple of other stories. We had a student who wanted to start a sport at Meadowdale High School, and they were excited as they had just moved from another state and wanted to start as soon as possible. The issue was that the doctor who wrote the physical said that they needed to see a cardiologist prior to clearance of school sports. The student was worried that they wouldn't be able to try out and was feeling upset. Their school-based health center was able to see them the next day. The nurse practitioner on campus was able to support the previous clinician, explain the findings to the students, and then refer them to the cardiology with an ASAP referral. The student saw the cardiologist within a week. When we usually wait times can be months, they were able to try out and make the team. Another student also from another country, came here with previous life-threatening health concerns. The school-based health clinic provider was able to see her on their next clinic day, wrote the necessary orders for them to go to school, and they were able to start right away. We had another student with severe vision issues. With the clinic support, the student was able to more fully participate in their educational experience. The clinic supported them every step of the way, including making appointments with other providers, supporting them with insurance, and with whatever else the student needed, medically speaking.
Yeah, and
Was that the one where she was using her phone on Zoom to be able to read?
yeah.
Because she hadn't seen an ophthalmologist since elementary, and she was a 10th grader.
And when we did our vision screening booth at Terrace, we got close to 200 kids screened for their vision. Around 25 needed a referrals, and we got them coupons, ESP coupons through our resources in the district to get free glasses and an eye exam, which is really great. And a lot of these kids were really excited because they knew they had vision challenges, but they couldn't afford to go or get glasses. But also having the clinic, there are limitations to our devices that we have to check vision. So sometimes if a kid has a strabismus, a lazy eye, anything like that, the machine won't detect anything at all. And so having the school-based health center, and we did it right outside the school-based health center, they were able to just call parents, get consent, do a vision exam, like a thorough one with a medical provider, and then they could get those resources. And so for those students who didn't pass in that exam, we still allowed them to use the school PSP coupon resources and go and get an official exam with an ophthalmologist.
That's okay, we're almost done.
Okay, so upcoming events that we have for our advisory committee. So at Meadowdale High School on Fridays, the students do what's called High Five Friday. Clubs, groups, sports teams, they take on different days, and they just say, you know, welcome to school, hi, like, have a good day, have a good weekend kind of thing. It's like the last hurrah for the week. We have our advisory committee signed up on May 17th to welcome kids to school. We have little QR codes that we're going to pass out to the students as they come in. Just say hi. If you have any like questions about, you know, the resources that you have here, scan this QR code with your phone, and you can check out what we have with the school-based center. On May 18th, there's the Health Fair Expo at Edmonds Woodway. This is something that is new to me, but my understanding has been around for a long time, and a lot of people in the community come. So we're really excited to have our booth there. We're gonna have something similar to the health fair that we did at Meadowdale with the nurses, explain what we do as an advisory committee, what resources are there for the community. And then we're teaming up with both schools have a HOSA program, which is students that wanna be healthcare professionals. And they do competitions, they go to state, things like that. It's a pretty cool club that they have. And so they're gonna do a health-related activity at our booth as well. At the health fair at Meadowdale, we did a blood pressure and pulse ox clinic. So here they're gonna do something a little different. The HOSA advisors are coming up with that, so that's to be determined. On June 1st, and that health fair expo is with both schools. So both of the advisory committees are gonna team up. And really in the future, I hope that we can have our separate advisory committees, but you know, once a quarter, so they meet together and say like, you know, blend these two communities together and see what the students are doing and come up with some new ideas. June 1st is the car show at Meadowdale High School. We're pretty excited. We're gonna enter a car. It's gonna be kind of a beat up car. We're gonna correlate. Yeah, we're gonna correlate car maintenance, you know, rotation, like tire rotation. Yeah, tire rotation, oil changes, taking care of your car, the body of your car, and how that compares to taking care of your own body, and like make comparisons of how like an oil change or tire rotation would be for yourself with annual exams, wellness, health, things like that. So we've had a lot of fun kind of spitballing ideas and coming up with things, and I think we're all pretty excited for that event to come. It is on the same day as prom, but the kids said they're still coming, so that's great.
Do you need a car for that? Because I have a senior.
Do you? We're looking for a car. We have one that has a little dent in it that we might put a Band-Aid on, but I want something
We
a
need
little more
something
beat
a
up.
little bit more.
Okay, so other events that are coming up, we're doing monthly lunch booths. Of course, we only have 2 months left of school, but we hope to continue this on next year. In May, our theme is dental, oral health. And like I spoke on earlier, so the high schools, the referral rate for dental is really low, and the usage is higher in the elementary schools and middle schools than it is in high school. This could be because they already have established provider, fear of the dentist, or lack of knowledge around oral health. So the dentists and the dental assistants are going to come to the booth, and we're just going to promote dental wellness, teach kids about dental health and some fun facts, and then hopefully get some kids referred to do smile checks. And so they would be sent home with consent forms. They would be smile checks appointments made with the clinic at their next clinic day, and they're blocking off some time to just fill up those slots.
And a smile check is basically an oral health exam, where they just see what the condition of the teeth are.
Yeah, and they can do those really quickly, and then they can decide, you know, you need a formal appointment. So that would be really awesome. We really want to, this year, try and get a senior information session going at both schools. Now, a lot of these kids are about to graduate and enter into the real world. They are about to lose these awesome services that they have to them. So we want to see if they, want to see if they want to get a last medical or dental appointment in before they don't have this free service to them anymore, but also give them resources on how to sign up for insurance, how to navigate the healthcare system and outside of school, as well as provide an opportunity for them. A lot of the kids going to college need vaccines, right? And so a lot of, if you're living in the dorms, things like that, those are required. So we wanted to get that set up and then get students with appointments for those vaccines. Freshman orientation, and then the feeder schools curriculum night and kindergarten registration. So this is where I got the idea from the parents' feedback, because although, okay, maybe they're not looking at Parent Square on orientation nights, and I know that juniors, seniors, a lot of those students are gonna be graduating soon, but I wanna try to help change the culture from the bottom and them just to understand. So as they're coming into the schools, as they're doing curriculum night, as they're getting registered as kindergartners, catching the parents saying, hey, this is here for you. Like, this is a resource that's specifically for you, for your students. This is what we can do for you, and just get them that information. And so really that's more of an information session for CHC, but we want to help as an advisory committee just bridge that gap. Thank you guys so much. We're really excited that we have the opportunity to create this committee. It's really fun, and it's really exciting to look at the data and see how it's going to change in the future. But yeah, questions?
Yeah, so lots of questions and a couple of ideas. You mentioned curriculum nights. Middle schools have their orientation nights, which is huge. I think that might be a really good opportunity to get there. And then there's also open houses for all the elementaries to it.
Yes.
And we really want to hit middle school because we want to build that culture before they even enter high school, so that when they get there, it's already a system that they're aware of and used to being engaged with.
And maybe even plugging into part of the middle school orientation to high school, because there's a process there. There's sometimes visits, but there's counselors will come visit, maybe to get in on that particular visit to have a session with all the students.
Yeah, and something else I forgot to mention too is including the information registration packets as students are registering. Just trying to hit it at all angles and just get the information out, so that way, you know, if one person isn't the type of person to look at papers, maybe they're like gonna listen at a meeting, or, you know, just finding ways.
And then the question that I had is, when is it coming to Lynnwood High School?
I know.
That is our next, that is the next targeted high school. CHC has asked us to give it a year or two, because they're currently working with Edmonds School District to consider opening 2 there. So they can only stretch so much.
Yeah.
But yeah, the goal is Lynnwood next.
Yeah, and I will say, I'm actively working with the building administration and CHC. They're willing to see McKinney-Vento students for immunizations and care at the other schools in the whole district. And so that's a population that is really underserved. The issue is there's just it's a lot harder for the consent and registration process because of their situation. So we're working on navigating that system in the schools they're in, and then hopefully by next year we'll be able to open up to those groups, and it's something that we've talked about a lot, and trying to just their process and how they register and how we can assist them.
Thank you.
Yeah. Any other questions?
Thank you so much. Thank you guys.
I did have, again, on the dental, because I think that's like a big one.
Yeah.
A big one for these kids. So are we, say we got all the kids, you know, on a regular dental system, would CHC have the capacity for all our kids, or are they working to try to get them set up with other providers?
Typically, CHC would like them to be there, obviously, within their system. But if they already are engaged with another provider, they will transition that care to their primary dental provider. But if they have no dental or medical home, they will assume responsibility. With consent.
No, I guess I'm
Our
just saying, we
dentist-
have many, many
Yeah.
kids who need to get established in regular, I think.
So, yeah, our
regular
dentists
dental
are,
care.
our dentists are our busiest providers, just in general, right? And so right now, they only have 1 day a week to give to the school, but they also will see those students at the actual Lynnwood clinic, and that's a faster process to get into them and easier than it would be other providers. So if they couldn't fill, I've had many students that needed like more emergent dental care, or urgent, and we didn't have appointments, and we got them an appointment at the CHC Lynnwood clinic. So they have that resource and that backing. It's more so just dental care in general is, there's less dentists and they're very busy.
And we're doing a lot of upstream approaches with CHC aside from the school-based health center. We do our dental sealant program that really accesses our second and third graders, where they do an oral assessment, obviously with consent of their parent, again, and guardian, where they'll do an oral assessment, apply sealants. We have seen kids at a very young age with abscessed teeth and things like that, and so those kiddos, they automatically feed them into their system to get care right away as well. And then we're doing regular smile checks in both our elementary and middle schools and even high schools, so that they're doing those assessments once a year and then feeding those kids into services. So even though they may not access oral health through the school-based health center, they are touching points throughout the school year with many grades within our system.
And at our health fair and at the expo, CHC has had booths and they have the dentist there doing smile checks, and those are so quick, and then they can say, okay, you look good, or you really need to be seen. And so that's a quick way to grab people that really are in need of services. And they've caught a lot, even people that weren't part of our, necessarily our district, but people in the community that just came to the fair, the health fair, were able to get their teeth checked, which is great.
And they didn't just look at students, they looked at seniors.
No,
everybody. So
little
it's kinda
kids,
cool.
it was really fun.
I was just gonna mention to your question, I've been seen at CHC for dental stuff recently, so, and they were like, oh, you have really good insurance. So, apparently, like, my insurance is good, I can go wherever I wanted, and I still thought about getting set up with them permanently. They are very good at what they do. The only reason I didn't get set up with them permanently is because I need, like, there's crowns and stuff, and they can't do that, so they have to refer me off for all of that. And so they said, you're probably better off getting set up somewhere where they can do that in-house. But they were really good. They gave me all of my options. There was no like trying to push me in one direction or another. It was a very quality thing. And when I was going into like a community health-based center, I was like, what am I gonna get here? And it was very good what they were
That's not my
doing.
concern at all. My concern is the numbers of kids that we have
Yeah.
who need regular, just
Yeah.
checkups, because
Well, it's a
it
good
keeps them
problem
out of
if we
school.
start getting
Yeah.
into the place where.
Yeah, we do have
So,
some
it's being-
schools.
What is our scaling plan? And I think you
Right.
described some of the things we're
And if
doing.
we are utilizing all of our services, I think CHC would be more than open to looking into hiring another provider, hopefully, and getting another dental day. Right now, at Meadowdale, the dental days are full, but not at Terrace, but we still have, it's more like, you can't see them this week, but maybe in 2 weeks, or we can meet one in 2 weeks. But if it becomes, we're to that point, I would hope, and I have high confidence in CHC that they
Plug
would,
them into their future system.
Yeah.
I mean, that's just, we know that that's a big contributor
Yeah.
to our attendance.
Yeah.
So I know we started this project a year and a half ago. I'm surprised where we've come, so we wanted to give you an update.
Yeah, no, thank you so much. Thank you for everything you all do. Thank you guys for
Thanks.
your student input and helping to make sure that the information is getting out to the other kids, because it's critical. And you're the ambassadors, so that's wonderful.
And
Thank
they're
you so
actually
much.
influencing services at CHC, which is awesome.
So I'm gonna call this meeting adjourned, this study session of the Edmonds School District